In today's Health Watch, heart disease is the leading cause of death in the U.S. for both men and women.
Local 5's Connie Fellman takes us to Crivitz, where a woman shares her message about paying attention to your family history.
You may feel a racing heart or especially fatigued and just chalk it up to stress or overwork. But as one local woman told me, if heart disease runs in your family, do not ignore it.
And so I'm going to be converting this.
When Barbara Uhl isn't repurposing old suitcases,
This is the fun part, getting all the guts out.
she's trying to keep up with her grandchildren.
My granddaughter, she's 3. She's a little pistol. She is going constantly.
But not too long ago, Uhl wasn't able to keep up. In fact, she almost missed out on seeing her grandchildren grow up altogether.
I woke up that morning about 6 o'clock and my heart was like quivering.
She didn't know it at the time, but Uhl's heart was in AFib, atrial fibrillation, an irregular heartbeat that causes blood to pool in the heart chambers.
They feel something flopping in their chest, or they just feel that their heart is skipping beats.
Dr. Prabhpreet Singh is a cardiac electrophysiologist with Aurora BayCare Medical Center. Singh says symptoms of AFib, like shortness of breath or lack of energy, are often missed because people think those are just signs of getting older.
Many patients just blame on getting older, and they just dismiss it, and lo and behold, they have atrial fibrillation.
Uhl admits, even though she has a family history of AFib, she didn't take it as seriously as she should have, until it happened again. And then, again.
I waited too long the first time, but I kept thinking, it's going to quit, and it didn't.
Singh says while AFib alone is not life-threatening, it can lead to potentially fatal conditions if not caught in time.
If we can pick something like atrial fibrillation before it causes something devastating like a stroke, I think that's a battle I'm willing to fight for.
He says the most common risk factors for AFib are related to lifestyle.
Smoking, alcohol use, diabetes, being overweight, family history of atrial fibrillation.
Uhl had heart ablation surgery last November and is currently on a heart monitor to keep track of her heart's rhythm. She also watches what she eats and is now moving right along with her grandchildren.
She likes to jump off the steps here and play superhero.
She says she wants others to learn from her experience.
You got to listen to your body. And if there's family history, you need to listen to it that much more.
Dr. Singh says the presence of AFib in the U.S. has been steadily going up. 10 years ago, there were about 5 million Americans suffering from AFib. By the year 2030, it's estimated that number will more than double. For more information, visit aurorabaycare.com. Download their Live Well app, or just give them a call, too. And that's your Health Watch. I'm Connie Fellman, Local 5 News.